Schuld and Joanne Schroeder. I hope I got that right, ladies.
Yeah.
Yay!
Well done.
Thank you very much. Sometimes I get marbles in my mouth, and I don't want to do that when I've got great guests in the studio for us to have this conversation. So, Kirsten, I'm going to start with you, if it's all right with you. Tell us a little bit about what social prescribing is and why it's so very important that our community understands the value of it.
Absolutely. So social prescribing is a comprehensive approach that addresses the social determinants of health. So the social determinants of health are non-medical factors that influence your health, right? So your income, your employment, your education, childhood, and where you physically are, your environment. So social prescribing consists of identifying patients that have unmet needs related to the social determinants of health and supports them to access resources and increases their connection. So what does that mean in simple terms? If you're lonely, you need more connections in your life. And social prescribing is a medical way that addresses these concerns and increases your social support.
I'm really glad that you're bringing this to our attention because I recently learned, and not that recently, I think it's been going around for a while now, that loneliness and that social isolation is like smoking in the sense as it reduces your overall health and wellness. We're seeing, is this because of COVID that we're seeing that there's a little bit more social isolation, or why aren't people getting out?
What a question. I think that there's a combination of factors, and unfortunately, our society is in a place where we don't have the connections that we used to. I think we were going that route with technology and phones and all of these things, and then COVID hit and shut us in even more.
Yeah.
There's economic factors for sure here that things are expensive and we don't get out. And neighborhoods don't do the same things that they used to. There aren't the block parties as much and potluck things, etc. And it's turned people in, you get depressed, you get isolated, you get lonely. And once you're there, it is really hard to get out of. So I think COVID played a huge factor in this. Would this have happened or been in need without COVID? I unfortunately think so. And I think in a perfect world, we would never need social prescribing because our communities, our neighborhoods, our cities would have things in place where we would support each other and take care of each other. But unfortunately, we're in a place in our world, in our neighborhood, and in Nanaimo where we need help with this kind of things. And social prescribing is an answer to help those people that need it.
Yeah, I think it's a really, important piece to sort of note that our world has changed so drastically, especially in the last 2 decades when it comes to technology and the way that we connect with each other. It's so different. I'd like to bring Joanne into the conversation. Joanne, can you tell us a little bit about some of the work that you're doing and why social prescribing has become a very interesting point for you to explore?
Yeah, absolutely. So I'm a prof at Vancouver Island University. I'm in the Department of Recreation and Tourism, and I really have a background as a pracademic. So I was in practice for many years in local government, municipal recreation, but also nonprofit associations. And then I've come into academia. So I've sort of seen both practice and academic environments. And I also chair a global board, which is called the World Leisure Organization. And it holds consultative status to the United Nations. So I'm seeing, this conversation of loneliness, lack of belonging, lack of connectedness across the globe, as, at a global level, as well as at a local context level. And, in coming to your question of, why is it happening? Certainly the fracturing that we see in society, but moving away from our families is a big part too, which we see in the Western countries, where we're not seeing a need so much is collectivist societies where they live together as families, they play together as families, they spend a lot of time, but we somehow have this sense that community can be online, but it gives you that false sense of connectedness. So I care about it because I think my discipline and my love comes from this leisure context, the leisure discipline. And, that study of recreation, sport, art, culture, festivals, events, play,
Mhm.
uh, nature, parks, getting out and moving, physical health. And so I've been watching the movement of social prescribing, which is not a new term. It just is a terminology right now that's helping us to understand what the World Health Organization is calling the coming epidemic of disconnection disease, the disease of disconnection, which is terrifying, right?
Absolutely terrifying. And it's true that, I think that the world has changed so drastically, and there's been so much emphasis that's been placed on using our devices as a way to be connected. But you're quite right. There is still a very big difference between what's happening on the screen and that physical touch, that being in the same room, that sharing and the breaking of bread, all of those things that really are
Yeah,
what community is about. And we're not supposed to be alone, right? As human beings,
yeah.
we're supposed to be connected. Kirsten, I'm curious about, from the Division of Family Practice perspective. The Division of Family Practice is known for working alongside the medical community and trying to find resources and ways for which that the community can be better informed. I'm curious about how social prescribing fits in with the medical circles, and is there a strong connection there?
Well, absolutely. So I'm a project lead at the Division of Family Practice. I have a master's in nursing, so my background is in healthcare. I did disaster relief and patient flow. So I actually have a bit of my background in this is I did disaster relief work in Indonesia after the tsunami and after a big earthquake, and then after Hurricane Katrina. And each time I came home was, of course, really hard. These were hard things to be in, hard things to see. And I lived in Vancouver. I was in my early 20s. And I found myself a little bit lost in this big city, working in the hospital. And I started volunteering for a unhoused dinner that we held weekly.
Mm,
And volunteering was the best thing I could have done because it gave me purpose. It gave me a sense of belonging and community.
yeah.
And that is the point of increasing your social connections, right? And giving back and making it not about yourself. And
Mm.
so, where this fits in with the community and the medical community specifically, and how the Division of Family Practice got involved, is I first off should say that Shared Care is part of Doctors of BC. They funded this project to get things started and off the ground. And that is how we could pay for me, pay for physicians, pay for a whole steering committee to get us all together to think, how on earth can we get this started in Nanaimo? And what we started was this team that all worked together. And I don't think we could have done it without each person that's involved. But
Yeah.
we have representatives from Island Health, from the city of Nanaimo, from VIU, and from United Way and Nanaimo Family Life Association. And without these big organizations coming together and prioritizing this, we wouldn't have gotten anywhere. And so this started, officially started 2 years ago, but there's been talks trying to get this off the ground in Nanaimo for 4 or 5 years. The executive director of the Division of Family Practice herself is from the UK. That's Becky Robson. And she just had a really great vision. Our lead physician on this was a physician that had been speaking about the effects of loneliness for years and years. And so we got together and got this off the ground. And what that means is we developed a pathway for a way that physicians can prescribe this to patients. And what they do is when a patient comes to them who is lonely, depressed, isolated, they can get a prescription for social prescribing, and that connects them with a link worker or a community connector who sits with them and figures out what matters to you, what did you used to love in life, what brings you joy, and connects them. And how does that work? Well, we work with the city. We get them into city classes that would fit with them. They maybe join an existing group in another nonprofit that works for them. They maybe meet them for coffee once a week. They go to their house and maybe set them up with a Zoom call with their daughter who lives across the country. There's a whole
Yeah.
host of things they do, but the overall goal is to just increase their social connections in any way possible. So we got that off the ground. We've been piloting it since we piloted it in the summer, and it's actually a full blown program now that any physician can prescribe their patients to. But it's more than that now. It's also other healthcare workers and clinicians can prescribe patients to. And for those that don't have a family doctor, they actually can self-refer or refer a neighbor, an aunt, a friend to Nanaimo Family Life Association. So we've kind of got it all covered. The only caveat is it is for seniors, and it's for those 55 and over, with the understanding that any age can need this. And the goal would be that this grows to any age and could support all generations. But we started somewhere, and we are seeing a massive need with our seniors in our community for this.
No question about that need. I am very familiar with many of the programs that are located in Nanaimo that are geared towards the older adult population. But I think what is really lovely about this is we're always looking for alternatives to medications, whether it's Western medication, Eastern, or whatever. And so to get a prescription that says, listen, you have a friend, you have someone that you can talk to, you have a community connector that's able to help facilitate getting you into a position where your life is more fulfilled, more rounded, whatever that may look like. I think that's a really phenomenal scope. And I'm curious about the benefits of the social prescribing. What have we seen so far as a result of these connections being made?
That's a great question. We've seen 268 people go through our program so far,
Wow, that's great.
which is incredible in not very many, not that long of a time. That's just since September. And we have seen huge stories, patients that hadn't left their house for years, that are now coming out and getting involved, even giving back and volunteering for the program itself. Nanaimo Family Life is able to reach a whole host of seniors and on that spectrum of needing support. And they've linked them with community resources. They've linked them with social work when needed. They've got them involved in a regular weekly activity. They've gotten volunteering and giving back. Sometimes it's an art class. Sometimes it's going swimming once a week, etc.
Yeah.
I think it's some simple things that can help. Joanne, in your case, and I want to bring you back to something that we were talking just before we came onto the program. You had stated that you were on a sabbatical and social prescribing was what you were looking for. So tell us a little bit about that journey and the connections that you have with this program, and also the same kind of question that I asked a moment ago. What kind of results have you seen as a direct consequence of this?
Yeah, absolutely. I'm going to come back to a comment that was said earlier about what matters to you. So, when that trusted person says, "What's the matter with you?" and it's determined that these are really non-medical, perhaps loneliness, isolation, depression, mental health, there's a switch that happens that Kirsten said, which is what matters to you. And all of a sudden you have the individual being able to participate or sort of co-create and have a sense of their own health, that autonomy that they can bring to, well, actually, I know I really used to like painting, but, I don't do it anymore. I don't feel well, and so paint 1 hour a day for 6 weeks, and all of a sudden, there is a sense of this is what I like versus, maybe it might be said, go walking once a week, or sorry, 1 hour a day every week, but I don't love walking. So I think something that's really important when we think about benefits is people start to invigorate and re-excite those things that at one time mattered to them.
Mm.
And then it can change, right? So like I do start painting again, but now I realize that I also love something else because I'm just feeling stronger and healthier. So I think for me, coming from this background where I have seen the visceral response of experiences within leisure. I see people that come into buildings, a senior, and is not feeling well and participates in lawn bowling. And then the next week they come and they're even happier or better. We actually see this on the front when we think of all these kinds of leisure engagement. So for me, it has been a part of my entire interest in both, working in practice, but also in academia's training in this area, but also working in this area. So when I think of benefits, my goodness, it goes from social, emotional, physical, uh, spiritual, all of those aspects that make a person feel strong and healthy and whole. And what we know is not everyone has access to that. So the other great thing about social prescribing, I mean, it's complex to put this into a medical modality. It's a bit complicated, actually. That we would actually have to prescribe someone to go walking or participate in art. But it's where we are in society. And so we want to get into that upstream where we don't need to be prescribing. People know that, that individual knows that art makes me feel happy and strong. So therefore, I'm going to find the time and build it into my life. So to come back to sabbatical, I really wanted to just carve out some time to be able to get into more reading in the area. And again, come into community and support all the efforts that are happening. And the reality is that health is not just in a hospital. It's
Mhm.
in community, and it takes all of us to contribute. So I've got another interest, which is, being able to influence those emerging leaders coming up in university through different disciplines: kinesiology, recreation, nursing, child and youth care, education, that together they don't feel that health is held within their discipline, but that it's an interdiscipline approach. And so that when they come out of their degrees as emerging, leaders and university students, that they come into community with a much broader sense of we all need to contribute to health in whatever age it is, specifically social prescribing now, we're talking about seniors, but we know, as was said, every age needs this. Every age is impacted by senses of loneliness, isolation. They need connection.
Absolutely, absolutely. Joanne, I'm curious because you are a professor and you are doing this work and you are molding and working with people on a multitude of levels with both your interests and with your profession. I'm curious, has social prescribing surprised you anyway, in any way?
Hmm. That's a great question. Well, um, Kirsten and I have talked about this before, where, this has been my area of interest my entire life.
Mhm.
Not necessarily social prescribing, but, connecting people
Mhm.
through engagement, whatever that might look like. And so I guess in a little sense, I've always been surprised that it's not just common knowledge that these things are good for us. But the flip side of that is that, it comes to right place, right time, right people, and even right political will sometimes to see change. And that's what we see in social prescribing around the UK is, it's been bedded right within their healthcare system. They have been evidencing it and, um, putting research behind it to say, is this really working? And they're finding it's having huge impact on their systems, their healthcare systems, and the health of their citizens. So I'm not surprised that it's being picked up. I'm not surprised that people are excited about it. I'm not surprised that when we get together in community, we actually really enjoy working together because we're after the same thing. I'm surprised it took us so long to kind of get to a recognition that we need to work better together in
Yeah,
community.
yeah. I resonate with what you're saying. I'm curious, Kirsten, from your perspective, when you work with the doctors at the division or you work with the teams at the division, were they surprised that they needed to spell this out on a prescription pad as compared to, like if it being just a natural, organic thing that happens, as you had kind of pointed out to Joanne, that why do we need to do this? Why are we at this stage? Did you find the doctors were resistant to it in any way?
No, not at all. Right away. And I think probably everybody listening, when you say what this is and who it's for, we all have a face in our mind of who this is that would benefit
Mhm.
from it.
For sure.
Um, and who's seeing these people day to day in and out is physicians, right? And they are dealing with patients that have so many physical things that's wrong with them, chronic diseases and comorbidities, but an answer to part of their physical health is
Mhm.
their social health and their mental health. And
Yeah.
so this is an answer to improve your overall health and well-being
Mhm.
in a simple way. And so this was an easy thing for any physician to think, what the heck? This sounds wonderful. You are bringing me a great gift to be able to offer this to a patient. It's non-medical, it's non-pharmaceutical, and there's easy gains. But I think the key in what we've seen in the program is we have to meet the patient where they're at and
Mhm.
get them wanting to receive the support and help, right? So
Hmm.
when a physician speaks with their patient about this and gives them a little bit of background and gets them ready, we don't want a big long wait list by the time that happens to the time they meet with the link worker and community
Very
connector,
important.
because right, and capture their readiness. So we've worked really hard to make sure we have that point of contact quite quickly so that we get them when they're engaged and ready. And the people that we have in these positions of link workers and community connectors, and reminder that these are the people that meet with these patients, they are the warmest, most caring, wonderful people to do this job.
Mhm.
And that's the key in making this successful is they spend the time that the patients need. They really
Mhm.
have the heart for figuring out what
Mhm.
matters to them, not the link worker themselves, but what matters to the patient and what they used to love and what brings them joy. So physicians have been absolutely on board, and it's a great
Mhm.
program.
Yeah.
Mhm.
Feel for sure is that so many older adults find themselves in emergency room just because they need someone to speak to.
Yeah. Yeah.
It's they're going into the doctor's office just because they're calling helplines and things like that, which are taking respectfully, not intentionally, because their need is real, but they're taking
Mhm.
away some of the resources for some of the more urgent issues that are going on in community. And so finding this wonderful opportunity to bridge that and to ensure that their health is cared for and connecting them to someone who's warm and kind and understanding and can help them see themselves through this, I think is really brilliant. I'm also really, kind of cognizant with the concept that not every older adult is lonely, and not every older adult feels that sense of loneliness. What's the difference between, that loneliness and being alone? There is a difference. What's your take on that?
Yeah. Yeah.
I think that that's a nice answer, and it's so true. You can be alone. We all love solitude sometimes, some more than others. Some are more extroverted or introverted than others, but you can be alone and not be lonely. And you can be in a room filled with people and be lonely. And there is a difference, and it's recognizing when people are lonely. Did their
Yeah.
spouse die? Are they at a crossroads in life where they've had a big change and they are truly lonely and are looking for connection and seeking it and just can't do it on their own?
Yeah.
Yeah,
Yeah.
people are, if this is a belief system that I've always had. I don't know if it will resonate with you. I hope it does. But really, there's also that fallacy that just because when you were young, you were shy, doesn't mean as you get to be an older adult, suddenly you're out there and you're verbose and you're ready to party and all of that, or vice versa. Just because somebody when they're younger is one way doesn't mean that they're not experiencing loneliness as they get older. So I
Right.
think that we need to meet people where they're at and not make those judgments on people. I feel that it's very important for us to be able to ask the right questions and ensure
Yeah.
that the team that's surrounding them is in fact doing that very thing.
Yeah.
And I
Yeah.
want to touch base on something that you had said as well in regards to the United Nations and World Leisure, the global board that you were speaking of. I know
Yes.
that there's been some tremendous research in Switzerland, Sweden, and in the UK regarding that bridge between younger generations and older generations and pairing them together to help contribute to social prescribing. What is your thought on that from a global scale? Are there areas in our world that are doing it really, really well that maybe we should kind of mimic, copy, steal, borrow, whatever it is that we need to do? Are we at the precipice of making ourselves in North America that opportunity for people to look to us for social prescribing? What's your take on the bigger picture?
Yeah. Bigger picture. So definitely, the UK is where we really see social prescribing's roots.
Hmm.
And they come from a social good philosophy within their medical healthcare system. And so caring for all within social good is what's at the root. What becomes complicated as you move around the globe is how a healthcare system within a country is set up. Is it private? Is it public? Is it a pay to play? Is it, how is it set up? So that seems to be a factor in there of how social prescribing uptake and the healthcare system is accepting it and how society is as well. So you see some places where, people won't go visit their doctor because it costs them. And so they would sometimes have ill health,
Mm,
but we can see where social prescribing, if there is a supportive system in their community or within their healthcare system for social prescribing, it really fills the vague or, these gaps. So it's difficult to answer that sort of holistically because it has a context
sure.
according to country and how it's functioning. But what we do know when we think of older adult and youth to come from this is that a particular factor that assists us? Well, absolutely. And we know that there's all kinds of research behind putting an older adult with a younger person. There's parts of the world where we see that that's just their aging policy as well. It's actually called an aging policy, is that if I took care of you as a child, now you need to take care of me as an older adult.
Sure. Yeah.
So sometimes it takes away, like that's how they function, but it's not necessarily um, a value chosen. It's how the society operates. And so we want it to be chosen programs and chosen that older adults want to be with youth and youth get to grow to love to be with older adults. So
Mm,
programs really help that. But I think when we come to this concept of uh loneliness, lack of connection, lack of belonging, youth are really at risk right now. And coming to my global perspective, they are at risk all over the globe.
mm,
And when we think of your earlier question, which was very good, loneliness versus alone, what matters to you, the sooner we can build into that young person, by the time they're 10 years old, as to what matters to them, so that they don't get locked into a system that, my teacher says I need to be really good at phys ed, but I'm not great at volleyball, so I guess I suck at everything.
understood. Yeah, for
We
sure.
need to be able to have their leisure language to say, I love sitting and reading a book and listening to the birds. That makes me strong. That's important,
Yeah.
right? And then they are able to build into their own lives at a really young age. And I think that's important when we think of trying to take the bulk out of the healthcare system where a young person or an older person are going into ER for things, into our hospitals, into our merge for things that hopefully if we can build strength into them at younger ages and maybe through, those co-connection through older adults, they're just stronger and ready to tackle life as it comes at you.
You know,
And that is a global issue, global.
I completely understand what you're saying, and I do see where different cultures and different locations in the world have different priorities when it comes to the family dynamic and where that all sits and how people show up for the older adult. I find that, as Canadians, and I'm proud to be a Canadian, we don't have the same connections that we once did with our families necessarily in Europe, and I do understand that.
Yeah.
Part of that is that divide. When people immigrated to Canada, several hundred years ago, or, even a few years ago, it doesn't really matter for the timeline. You kind of leave everything behind when you come to a new place. And that in itself has its own structural issues. Those same family dynamics that were familiar and used in Europe may not necessarily be as easy to incorporate into Canadian society. And so I do resonate with that, how things are and how they are different and how people, when they're younger, can really play a role in what will matter to them later on. I have
Yeah.
4 grandchildren, and I'm very proud that
Mhm.
they live very far away. But
Mm.
one thing that I want to ensure is even though there's a distance between us, we have that connection, even if it is by Zoom, so that when they're older, they may go, my grandmother was blank, 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 so that there's a knowledge there and an understanding. We
Yes.
didn't have that before COVID, really, or
Yeah.
before the advent of Zoom and some of that. So I
Yeah.
see where there's been some real improvement in the way we're able to be with one another, but nothing
Yeah.
takes away from that physical connection for
I
sure.
would just add to that from your question is that social prescribing is really very new, though. I
Yes,
mean, though it has been around for, 2 decades or more in the UK, it really is new around the globe. The
yes,
concept, is not new. It's understood, but the language of the terminology. And so there's a lot of hope that I think what I'm seeing again, from a global perspective, is a lot of hope that when there's a lot of people that get very excited about it when you talk about it. And
there's
Kirsten, I would say the same. You're experiencing that, just the excitement from
Yeah.
the doctors and physicians that are really, is this real? Could this really work? Could this
a lot of
really take?
buzz. There's definitely, and sorry to interrupt you, Joanne, but there is an awful lot of buzz. It seems that when any of the emails are coming through, where this wasn't the case a decade ago, when emails come through, there's a lot of buzz around social prescribing and getting people to be aware of it and understand. Which brings me to my next question, Kirsten. You did touch on it a little bit ago about wait lists and that ability. We know that there's somewhere around 20,000 older adults that live in the Nanaimo area alone. We know that the need is absolutely huge, and while a few hundred people have already been served and supported, is there a limitation to this work, and is there a way that we can as a community help to expand that work?
Mm.
That's a great question. So a part of what I'm tasked with in this project is not just getting it off the ground, but getting it to a place where it's supported and sustainable
Hmm.
and can grow to other communities. So these discussions are happening all across island health, all across the province, all across the country right now as social prescribing grows. We're doing everything we can to, when we have a wait list, like everything in healthcare right now, is to make that initial contact that I was kind of speaking about before and get that patient when they're ready and capture that. So the wonderful part is both of these link workers and community connectors that we have are supported by other programs that they're a part of, other resources, so that somebody touches base with this patient and connects with them right away.
Mhm.
And then the wonderful part of this is if we use that quote of 20,000 seniors, not 20,000 seniors will need a social prescription. So the
Exactly.
important thing that we can speak about today is raising the awareness of needing social connection.
Mhm.
And, I don't need a social prescription right now. I've got a full life. I've got 3 kids. I see people all day long.
Mhm.
But somebody else in the same position as me might. And so, what we're really trying to do is raise awareness of the importance of social connection. And we talked a little bit about loneliness and being alone. And what a lot of us do is go and seek out opportunities when we're feeling lonely. Being lonely is not necessarily a bad thing unless it starts to affect you. And having a little bit of loneliness in our life spurs us to go find a connection and make those connections. And
So
we all
true.
have times in our life where we naturally will need to go out and do that. But there's going to be a small percentage of people that need help with this. And for whatever reason, it's not like it's anything to be ashamed of, but just, hey, I'm
Mhm.
stuck. My spouse died and I cannot get myself out of the house, or I just moved here and I am having such a hard time making
Mhm.
connections. We hear that
Yeah.
kind of thing all the time. And so this is a positive answer, because what I don't want anybody to take out of this is you hear all the time right now, it's everywhere, how important connecting is and how important it is to increase your social connections. You know, we referenced it at the very beginning. There's a lot of studies coming out that being lonely and isolated is like the equivalent of smoking cigarettes, et cetera, et cetera. But it's awfully depressing to say to people how important that this is, but then not give them a way to get out of it. And so
Mhm.
for those people that need that boost and need that encouragement, that's what this is for. For everyone else who don't quite need a social prescription from healthcare or anything, the message is keep your social connections going. As you get older, it gets harder. Some like join that walking group, stay connected with your family, get
Yeah.
out as much as you can, interact with the employee at the grocery store, say hello to your neighbor, volunteer where you can, all of that kind of stuff, because it doesn't seem that important, maybe one on one and on their own, but all of them cumulatively affect your overall health.
I couldn't agree with you more. I think that it's
Mhm.
really important to recognize as well that some of the social connections that people have, and I would like to re-educate, for lack of better words, our community to get to really wrap and lean into this, is if you are seeing, if there's an elderly person in the bank teller or at the grocery store,
Mhm.
at the
Mhm.
market, wherever it might be, allow them the grace to take their time to have
Mhm.
that touch point, because quite often it's the only touch point they may
Mhm.
have in the week. And so, rushing and rushing, if you feel that you're in a hurry, please use the automatic checking machines. Like, please use the equipment that's available for you to do that. Or if you need the social connection yourself, don't feel rushed. It's your time. You are
Mhm.
valuable, and it should be okay for you
Mhm.
to be able to take an extra
Mhm.
minute or two to get that connection.
Yeah.
Yeah, that might be the only connection someone has in a day.
Absolutely.
Mhm.
I
Mhm.
think a lot of people have someone in their lives that, that we worry about, that they have decided to go very inward as opposed to
Mhm.
being out in community. I think that that's a flag. If they used to go out all the time, if they used to go to the market, if they used to do their shopping, and
Mhm.
now they're nervous about going out, there sometimes are other medical reasons associated for certain, right?
Mhm.
There's lots of reasons why people are nervous about going out now. But just to take, it's hard to be brave that first step. So what would you recommend for
Mhm.
that person who wants to make the call for social prescribing, but is still on the edge of how do I actually take that first step myself? How do I bravely tell the doctor that I'm afraid, or that I'm lonely, or that I feel like I'm just kind of depressed in this age, and don't know where to begin or where to start? How do we bridge those conversations for older adults?
That's a great question. I think specifically for physicians, the answer isn't to say, like, oh, go talk to your doctor about this, but right here it is. And it's taking that first step to bring it up. Doctors are, sorry, loneliness is starting to be seen as the fifth vital sign, right? So it is starting to be like, hey, what's your blood pressure? What's this? Are you lonely? How many connections do you have? How many people do you see a day? So the language for physicians is out there, and they are checking in with their patients on this kind of stuff. It is at the forefront of their mind. So there's a great chance your physician will bring it up with you. And if not, every physician in town has been made aware of this program, knows about it, knows how to refer. So we are encouraging people that do have a family doctor that feel like this might be the right program for them to speak with their doctor about it. For those that do not have a family doctor, to get in touch with the Nanaimo Family Life Association. They not only have this program, but they have a myriad of other programs that also support older adults that might be the right fit for them as well.
Yeah, I think a
Mhm.
little research
Mhm.
goes a long way, and it's not, that there
Mhm.
is information that's available out there for our viewers who are watching this on YouTube. And I'll just take a quick moment here to address that. If you have just tuned in, thanks for tuning in to CHLY 101.7 FM. If you want to know further information about this program, do check us out on our YouTube channel. You will find all of in the description box, you'll find all the information that you need to be able to access the Nanaimo Family Life Association and the Social Prescribing Program, amongst many other programs that are available. And I do really want to encourage people to take a moment and really assess yourself. Where am I now?
Mhm.
At where you are at your age, who is in your circle of influence?
Mhm.
Who are you surrounding yourself with? Have you, like, just ask yourself the question, am I lonely or am I just happy to be alone? What does this
Mhm.
really look like for me? Because I know
Mhm.
that as we get older, we do start to see that our needs have changed. And often we get into habits we don't even realize we've gotten into. You get up in the morning, you're watching TV all day, and all of a sudden you're looking at the television going, oh my gosh, where did the day go? And you're
Mhm.
content with it. That's perfectly fine. If that makes you feel comfortable and happy, there's nothing wrong with that at all. But if on the other hand, you're like, I am bored and I just am looking at these walls and I don't know how to get out, or you have a difficult time creating
Mhm.
conversation with someone at the grocery store, or you're feeling like
Mhm.
no one wants to be with you, maybe those are signals that you need to reach out and see if the social prescribing is right for you. Joanne,
Mhm.
what's your thought on that?
Well, and I think as we elevate the conversation of social prescribing, the awareness of it,
Mm.
it also becomes awareness of good friends.
Yeah.
So, it's not just the physician, but be a good friend. If you're noticing, someone within your circle, even someone in public that you notice is, in that grocery store, I think it's helping us to be more aware that, hey, loneliness really is a real health issue.
Mhm.
And, not being connected and not having a sense of belonging. And so I think it also helps us, while maybe innately we know that,
Yeah.
just the conversation of it and having a title, social prescribing, a label. I think it just helps everyone to be aware that this is really important, and it's really important that we all are a part of it.
Yeah, absolutely.
Hmm.
It's funny that, over the years, just before COVID, we started to hear a lot about it. The silver, well, I think what was it called? The silver wave, right? Where so many of the baby
Mm.
boomers had
Yeah.
recognition that this wave of older adults was going to be upon us, and we needed to really resonate with what older adults need. And it's interesting to me, as you mentioned, Joanne and Kirsten, that there has been this sort of movement as we're getting older to really pay attention to the volume of people and the needs and
Hmm.
the changes that
Hmm.
we might not have really talked about a decade ago or
Hmm.
2 decades ago. Do you think there's that there's a connection between that wave of older adults, or do you think that it's just a matter of we came out of a pandemic, we've grown inward? Everyone in the world did. So there's that part, and even though we're certainly on a better path, there's still a lot of fear that's associated with us getting out there, for fear that there still is more COVID to come or more disease to come. There's the seasonal changes that we experience with winter. We're like cold, we don't want to go out. Like, are all of these symptoms?
Yeah. I think it's a bit of a perfect storm, right? And
Yeah.
it's not that we didn't have these problems 20 years ago. I think we had
Mhm.
resources perhaps to address them. I think I touched on that a little bit earlier, just with the way things are economically right now, things are really expensive. So maybe you're less likely to go and pay that drop-in fee for a class or go to a coffee shop and just hang out and chat. Specifically here on the island, yes, we have a massive senior population, and with
Yeah.
that comes we're all very aware of the burden and strain in healthcare, and it's draining resources. And with that comes less visits to the doctor's office, more isolation, et cetera, et cetera. So we're just at a place in time in our world, in our country, and in Nanaimo where this is a problem and this is meeting the needs of where things are at. We didn't touch on this too much, but I think some listeners would want to know that a huge study was done this last summer. Joanne and I reference it all the time. Anytime I talk about it with social prescribing, because I often am talking to healthcare providers on it. It was done with the Canadian Institute of Social Prescribing and Red Cross and KPMG, because this is something that's a little bit hard to quantify, right? You need a lot of
Sure.
time. And what of course you want to prove is, does this increase overall health and well-being?
Yeah.
But what found is it's significantly reduced ER visits, it's significantly reduced hospital admissions, long-term care admissions, physician visits, and for every dollar invested in social prescribing, $4.42 are returned back. So it is getting some traction nationally. We are hoping, I mean, our steering committee and all of our partners that have gotten this project off the ground, we are trying to raise so much awareness for this. This would be the best thing ever if you went to your doctor and right down in their office was that link worker waiting to meet with you, and that this was accessible and easy for all and part of our healthcare system.
Yeah.
Yeah, I agree. I think that there's something to be said with having the more and more that we become aware and that it becomes a part. I mean, let's face it, we know that there's less and less doctors that are available for people. We have a shortage of doctors all over Vancouver Island. The appointments now are 5 minutes. They're quick, they're in, they're out. There's a very little capacity to be able to really take care of patients the way we once did. And so
Yeah.
I think it's really important that if we could find a way to link that and bring that alongside, whether or not it's the nurse care providers or whether or not it's someone else along the team that can sit in that office and be present and really
Yeah.
support them with social prescribing. I think that's a brilliant way for us to spend our dollars.
Yeah.
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 And with that, go ahead, Joanne.
Well, the silver, coming back to your comment, Kathy, of the silver wave, it's here.
It's here.
And that conversation of, is happening all over the world, of course, and those countries that have the oldest population. I was just in a conversation with Japan and involved in a conversation around social prescribing. And it has to be a contributor to some very significant solutions that they are facing when you have such a large population with such high demographics of age. And so it's important, to that we can't negate that there is definitely a demographic issue that was coming and is here.
Yeah, I'm excited that it's here for a lot of reasons. I think that there's something really wonderful. And I do think that we're of an age group where we get stuff done. And I mean that with respect, right from the changes that happened in the 60s, the 70s, the 80s, the movements that we've had. I think that so many of our older adults were at the charge of many great initiatives. And I believe strongly that they're still at the charge. And I think that that's a really wonderful thing. We really talked a little bit about the social determinants of health, but that's an alien term for a lot of people who may not know what that is. And I wonder if we could just take a moment to really share with our community, what exactly does that mean? What are the social determinants of health?
Yeah.
For sure. Yeah, they are Social determinants of health, it's a concept that has been around for a long time. They're non-medical factors that influence a person's health. So these are your income, your employment, your education, your childhood, and your physical environment where you live, where you grew up in. And all of those things are non-medical components of your overall health and well-being.
Mm.
And I think something that needs to be said is social prescribing touches on that, but it takes the onus off the healthcare system and puts it back into the community. And it makes the community start taking care and being responsible for their own, because the healthcare system can't do it all. So you can get a prescription from your physician for this, and then it goes out of the healthcare system and into community supports. And to me and to everybody that studies this, that is an answer in these years to come where we have so many resources that are getting drained in healthcare. We have such need for staffing, et cetera, and starting to look at it with a different lens. Joanne always speaks to that the recreation lens have been working on health promotion forever, and it's
Yes.
not something is thought about in, I went to nursing school. I took a master's in nursing where you don't hear about this, that, oh, there's other professions and other departments that are also looking at this. And if we want to look at long-term solutions for healthcare, it's looking at other ways to help our overall health and well-being.
Yeah, I could see how that has been missed in the bigger picture of things, where we don't necessarily see the transferable and the lateral pieces that take
Yeah,
us and
yeah,
connect us from, one discipline to another discipline in the business
yeah,
of our learning and experiencing.
yeah,
Um, Joanne, I keep I keep coming back to the way the world is and all of this, because knowing that you're able to sort of see this from a macro, bringing it into the micro.
yeah,
I'm curious, when Europe talks about it being like so much a part of what they're already doing, the UK in specific, what were their baby steps that came to these? Like, did they have significant baby steps? Are we in baby step right now with social prescribing? Or was it a fall on in happenstance, and therefore the need was recognized and driven right away?
yeah. Well, I just actually had a conversation not too long ago with someone from the UK and asked exactly that question. I'm like, why did it work there? Like, what was the
Hmm.
uptake? And one of the things that happened is that can't necessarily be controlled in countries, but what was happening there is when the party came into power at that time, a health report was written, and every one of those political members were responsible to understand that, and that was the approach that they were taking,
Hmm.
which was social good, public good through this type of a model. And when I say not every country can do this, they have held the same political power there was a period of time where it was held for many years.
Hmm.
It means that there wasn't change. And that is an important piece of uptake, is that it takes time. Momentum takes time, but you also have a philosophy and a belief that keeps growing, and that's what makes change. Now, a wonderful thing that is happening is that just that previous conversation you were having, we're starting to get in these trusting environments where we're willing to talk to one another and say, okay, I don't necessarily understand your discipline of social determinants of health, that that's the language that you use. I may use a different language in my discipline, but we're after the same game. Let's figure this out and feel okay. And I think that's what social prescribing does too. It helps to break down these barriers that we've come up in disciplines with different language. So that's something that the UK, it has been a benefit to them to help them mobilize. Are we at baby stages here in Canada? I think we're pioneering, is what the language I would use. But I think there is such interest and mobility to move this forward. And it's an important conversation between health and other disciplines that are also health drivers,
Wonderful.
right? And so together we're realizing we need both. And we have to work together. So are we at a baby stage? I think we're beyond baby, but I think we're pioneers, and pioneers work hard to make change.
I love the terminology. Pioneers agreed. I think there's something really quite wonderful about being pioneers and mavericks, right?
Yeah.
A little bit of
Yeah.
both. Listen, we're unfortunately out of time for us to be
Yeah.
here today. I can't believe that that hour went as quickly as it did. It was such a treat and a pleasure to be with you both today. Thank you so very much for your contribution to this conversation and for really bringing the point of social prescribing to the forefront so that our community hopefully will take a next step. As we close out, Kirsten, I wonder, could you please just remind us, how do people reach either yourself or, again, you mentioned NFLA? Can you shout out how people can find out more about social prescribing?
Yeah, absolutely. So, clinicians, professionals that are interested in this, can email me. My contact info is all on the Nanaimo Division of Family Practice website. The community that's interested can get in touch with the Nanaimo Family Life Association, and Kathy said that info would all be on the YouTube channel and included. And that's not only just if you are interested in being a participant in this program, but we need volunteers to help continue to support this. We need extra funding to continue to support it. And if you just want to be a part of it to raise awareness of the importance of this, there is definitely a place for anybody there.
That's fantastic. Thank you both so much for being on the program today. It's been an absolute pleasure. We'll see you next time on Act 3.
Thanks, Kathy.
Thank you so
Thanks,
much.
Kathy.
Bye for now,
Bye-bye.
folks.